Hi guys, welcome back. I hope everyone is safe and everything is getting back to normal. So, today I am here to talk about the healthcare system in Canada. So, this is a very trending topic nowadays. Whoever coming to Canada, you would have heard from your relatives, oh, that country, there is a lot of good healthcare. So, yes, this is gonna be our topic for today. Let's start the video then. Canada's universally funded healthcare system, which is known as Medicare, is a universal health system where a lot of people having access to as being a taxpayer. It provides equitably access to physician and hospital over the 13 provinces and territories. It is known to be one of the best healthcare overall. But to add, there will be a lot of pros and cons as well. Canadian citizen, PR, foreign workers on work permit, students on study permit have access to free health insurance after 90 days of time. They even can apply for a free health insurance card by each province provided. So check which province you belongs to, and once you land in Canada, you just try applying for that. You will receive it after 90 days of your visit. Healthcare in here will be directly paid by the government by the taxes. Each province has their own health insurance plan. Make sure you check which province you belongs to and apply now only. The very good part is, in case of any emergencies, we just go to any hospital to an emergency department and get it treated. And even there are a lot of walk-in clinics. But due to COVID, there are we have to call the clinics before visiting them. So the free medical health insurance plan covers the basic medicines and all the facilities which one you need for taking a good care of your health. But if you want to have an hearing aid or dental care or any physiotherapy, then you have to go for a private health insurance even after 90 days. So that usually, as I mentioned in my previous video, you have not seen that, please go and check that one before. If you are having an ME employer in Canada, then what happens? You will be getting a private medical health insurance which covers the things which are not covered by the free medical health insurance by government. So that will be one thing which will be added here. So usually talking about a free health insurance covers only the basic medical plans. But when you have to have a dental care or a hearing aid or a physiotherapy, then definitely you have to go for a private medical insurance, or you have to pay from out of your pocket. So if you are having any employer in Canada, then what happens? They will get you a medical insurance which covers you and your family. So, and usually what happened, we went to hospital. Live example if I want to share, these are the all pros of the Canadian health system. But in reality, you have to wait a long to get an appointment, and even if you get an appointment, you have to wait another long terms to get another appointment to follow. So yes, this is a bitter truth we can tell. So here the mostly people are so conscious about their health, so they'll take care of it very properly. Even I have seen a lot of people just being a very health conscious here. So fine, this is all about the Canadian health system. But in reality, if you want to speak, if you are coming to Montreal or any Quebec cities, I'll just share you our experience which may help you. So what happened is, when we came, we applied for a RAMQ card. That video is also up on my channel. You can go and check it and get an information how to apply it online. So once we get an RAMQ card in our hand, what we have to do next will be to register a family doctor. When you register family doctor, you will be having a huge queue to get one. Ours is, we registered 3 months back, and ours was 360 days approximately. So after 360 days, I'll be getting one family doctor. But before that, what I'll do, if I get sick, where should I go? I don't know where should I go. So before that, if you are getting sick, you will be having if it's emergency, you can call 911 anytime and you will be getting served for that. But if you are having anything like stomach pain or a cold or a fever, you have to call Info Santé, that is 811. So in this case, when you call 811, the timing will be really huge, wait time will be really huge. Actually, 2 weeks back, my husband was really sick with a stomach pain. We called 811 and it was like 1 hour 15 minutes of wait time. So yeah, after that a nurse attended our call and we got an appointment on a telephonic conversation. But unfortunately, what happened, the nurse who was taking it took our pin code or a postal code wrong, and we got an appointment 40 kilometers from here, from the place where we are staying. So it was a telephonic appointment, but at the last minute the clinic called us and told, no, we can't have a telephonic appointment, you have to come over to the clinic. It was a COVID situation, so it is very bad, very tough to go into the clinic directly, and time was not limited for us. We needed at least half an hour to 45 minutes to travel to that place, and we were having the appointment at 6, but we got a call at 5:15 or 5:20, somewhere around there. So we cancelled that appointment. We have to cancel it, we couldn't get that one. So this is the one drawback which we faced. And one more is, next day again we just checked on website, I'll just link that as well here, where you can find a walk-in clinics, get an appointment today or tomorrow in that case. So we just checked that one, and what happened here, there was we even got an appointment with a clinic and we spoke with the doctor as well, but doctor forgot to send us prescription. Even after till today, it's after 2 weeks, after calling 2-3 times to the clinic, we have not received a prescription. So in this case, it is really worst. So you have to be really healthy to take care of yourself before you go to any doctor. As everyone says, precaution is better than cure. So just we have to make sure we are healthy enough to not to get the small pains like stomach pain or fever or something like that. If it's coming also, you have to treat it by yourself in some cases to avoid the time consumption and the stress. So this is the thing which went wrong with us. But to share up my experience, I had a good experience with the clinic. Actually, I went to gynec, but it was really tough at the beginning to search for one because of the COVID situation, and most of the clinics which I called were telling that if you have a file open then you can come over, but there was no file open for me as I was a new immigrant. And then what happened, I luckily got it, but it was little far for me. I have to travel by bus to get to go there. I went and I got an appointment, and it was a good thing which happened, and I had a lot of follow-ups and a lot of scans, and everything was done free of cost. So this was my experience. I didn't spend a penny other than a cab or a stamp cards. That's it, I spent on, that's all. So this was my experience, but the wait time was really huge again. So can't complain about the wait time. If you are in emergency or something, you have to definitely call 911 for this. But if you are having not so serious condition, then you have to wait for some time to get an appointment. To add here, the medical system is really good. Unfortunately, because of lack of doctor or lack of nurses, there is a lot of time delay happening. So some clinics are like that and some clinics are really good. Yeah, I'm still having a follow-up with doctor now. The clinic is good, but the wait time is not so good, I should tell. The medical system is good, the wait time is again not so good, I can tell that as well. So it is really tough. But to add, if you are having any serious conditions, you can directly walk into any emergency department of hospitals, any hospitals. They will be taking care of you again free of cost if you are having a medical insurance card. If you are a visitor or something, again you have to go for accordingly temporary insurance or something, you have to see that as well. So these are the things which happened in our lives. I wanted to share this of course, because I saw a lot of videos. I couldn't find any, how to find an appointment, how to fix an appointment, how to find a doctor. I couldn't find any, so I thought this video will little help you in some cases to give you information about Canadian healthcare system, that too in Quebec. Let me know if you have any questions on this. There will be a follow-up video for this as well, how to book an appointment, how to find a clinic and where to find it, what are the tests and what are the coverages it will be done. Most of the things will be covered, so just stay tuned for that as well. Thank you for watching.